Hello students, my name is G. Nikita. I'm Pharmacy Assistant Professor, Department of the Pharmaceutical Chemistry. I will deal the Medicinal Chemistry 2 subject for B Pharmacy third years first semester. So today we are going to discuss about drugs for erectile dysfunction. So it is the fourth unit. So in this we will discuss that introduction. In this, we will discuss the introduction and what are the causes of the erectile dysfunction and what are the drugs we have used to avoid this problem and what is the mechanism of action means how the drug will act in our body structure. Adverse drug reaction is also known as side effects uses. So let's discuss what is erectile dysfunction. So erectile dysfunction and the benign prostate hyperplasia, these two are the common urological disorders in the male. So these two problems is mainly observed in male. So this erectile dysfunction is the inability to maintain the penile erection for the successful performance of the sexual activity. So the person, those who are suffering with these two problems, they cannot able to perform the sexual activity successfully. So here benign prostate hyperplasia means the uncomfortable urinary symptoms means the person cannot able to uh, have the urine outflow freely means the blocking of the flow of the urine in the bladder means what will happen in this case there will be the blockage of the urine in the urinary bladder they cannot able to uh, means in this case the person cannot have the urine output freely and also they have the urinary tract infections and also the kidney problems. So this is the meaning of the benign prostate hyperplasia. And what is a urological disorder means the infection will be occurred to the urinary tract. So it is a urinary tract infection mainly seen in the male. So what are the causes? It has many causes, but some of them are vascular disease and diabetes, and some persons are using different medication. So by using this different medication is also the cause, and also depression. So this benign prostate hyperplasia is the non-malignant enlargement of the prostate. So it here the prostate will get enlarged and which can occur naturally in the men age means as the age increases in the men in that case only we can able to see the benign prostate hyperplasia but this ed we can able to see in any of the aged person but this BPH means benign prostate hyperplasia can occur in as the age of the men will increases. So what are the drugs used for this disease means alprostadil and avanafil and sildenafil and tadalafil and verdenafil. So these are the 5 drugs which has been used for the erectile dysfunction. So what are there? Alprostadil and avanafil and sildenafil and tadalafil and verdenafil. So these are the 5 drugs. These drugs which comes under the phosphodiesterase 5 inhibitors. So what is the phosphodiesterase 5 inhibitors? Let's see. So all the 4 drugs we are seeing now avanafil, sildenafil, tadalafil and verdenafil. So these 4 drugs are more effectively used in the treatment of the erectile dysfunction. So for these four drugs have the same uses, and also the adverse drug reactions are similar, but the duration of the action and also the absorption of the food is different for these four drugs. So this sildenafil and tadalafil have also used in the treatment of the pulmonary hypertension. So these two drugs, what are they? Sildenafil and tadalafil are not only used in the treatment of the erectile dysfunction, but also used in the treatment of the pulmonary hypertension. So the drugs, there are four drugs, that is avanafil and sildenafil, tadalafil and Vardenafil. So these four drugs comes under the phosphodiesterase 5 inhibitors. So it is more useful in the treatment of the erectile dysfunction. So these four drugs have the same uses and also the similar adverse drug reactions. But it is different in the duration of the action and also the absorption of the food. So absorption of the drug with the food. And this sildenafil and tadalafil not only used in the treatment of the erectile dysfunction but also used in the treatment of the pulmonary hypertension. So, taking of the tablet will not automatically produce the erection. So, the sexual stimulation is needed first to cause the release of the nitric oxide from the penile nerves. And this medication will amplify the signal, allowing some men to function normally. So oral erectile dysfunction medication will not cause excitement and are not needed in the men who got normal erection. So the persons, those who are normal, no, for that person these drugs are not required. So what is the mechanism of action? Let's see. Sexual stimulation will result in the smooth muscle relaxation of the penile tissue, that is corpus cavernosum. It will increases the inflow of the blood. So here the mediator of this response is nitric oxide. So nitric oxide will act as the mediator. It will activate the guanyl cyclase. So the nitric oxide, it will activate the guanyl cyclase which form from cyclic guanose monophosphate, that is CGMP. So this the guanyl cyclase is formed from the cyclic guanosine monophosphate from guanosine triphosphate produced. So smooth muscle relaxation through the reduction in the intracellular contraction. So here what will happen? The nitric oxide will act as the mediator, where the guanyl cyclase will get activated from cyclase guanose monophosphate. So this nitric oxide will be activates the guanyl cyclase. So which from the cyclic guanose monophosphate from guanose triphosphate. So it will produce the smooth muscle relaxation through the reduction in the intracellular contraction. So this PDE means phosphodiesterase. So PDE full form is phosphodiesterase. Enzyme is responsible for the degradation of the cyclic guanosine monophosphate. So the duration of the action of the cyclic nucleotide is controlled by the phosphodiesterase. So here the total function has been controlled by the phosphodiesterase enzyme is most responsible for here. We see here the sexual arousal, here nitric oxide, and this nitric oxide is converted to guanosine triphosphate. So GTP full form is guanosine triphosphate. In presence of guanyl cyclase, it is converted into cyclic guanosine monophosphate. CGMP means cyclic guanosine monophosphate. In the presence of PDES, PDE means phosphorus diester inhibitor. It get converted into 5-GMP, and here in presence of the protein kinase, what will happen? The calcium will be decreased. So the main function of the calcium channel is contraction of the muscle. So here what we have to do, the relaxation of the smooth muscle should occur. So if we reduce the calcium channel function, so the smooth muscle automatically get relaxed. So then automatically what will happen? Penile erection. So this finally we can able to cure this disease. I will explain it again. See mechanism of action. The nitric oxide will get converted into the guanosine triphosphate. GTP means guanosine triphosphate. In the presence of guanyl cyclase, it will convert it to cyclic guanosine monophosphate. Triphosphate, here monophosphate. So this is converted to 5-GMP in presence of phosphodiesterase inhibitors. And next, in presence of protein kinase, here decrease the calcium channel functioning. So what is the main function of the calcium channel? Contraction of the muscle. But here what we want? Relaxation of the smooth muscle. So in order to get the relaxation of the smooth muscle, the calcium channel function has to be decreased. So next, finally, the penile erection, and so by this way we can able to cure this disease, and this is the mechanism of action. So next, pharmacokinetics. So the sildenafil and vardenafil have the similar pharmacokinetics properties. So these two drugs have the same pharmacokinetic properties. Both the drugs should be taken before the sexual activity. Means 1 hour before the sexual activity, this drug has to be taken. But this drug will enhancement observed for 4 hours after administration. So it will enhancement observed 4 hours after after the administration of the drug. Thus, the administration of the drug must be timed appropriately with recorded to the sexual activity. So this drug should be taken before the sexual activity at exact time. But the Tadalafil have the lower onset of action, but Sildenafil have the longer half-life of approximately 18 hours. So it's poor for once a daily dose, means if you take the only one dose for a day also enough. All the inhibitors are metabolized by cytochrome enzyme in the body. So let's see first drug. That is first drug. What is its name? Sildenafil. So sildenafil is the drug, and this is the IUPAC name, and this is the structure of this drug. If you see the IUPAC name, 5-2-ethoxy, 5,4-methyl, piperazine, 1-YL, sulfonyl, phenyl, 1-methyl, 3-propyl, and pyrazole, pyrimidine 7-ol. I will repeat it again. 5-2-ethoxy, 5,4-methyl piperazine, 1-YL, sulfonyl, phenyl, 1-methyl, 3-propyl, pyrazole, no, pyrimidine 7-ol. If you see here in the structure, so this is the pyrimidine structure. For the pyrimidine, at the 7th position, oxygen is there, and here at the 5th position, the phenyl group is attached. So this phenyl group at the 2nd position, the ethoxy group is there. Ethoxy means 2 carbon atoms are there, so it is ethyl. Here one of the oxygen atom is there, so it is ethoxy. And again here in the 5th position, one of the sulfur and 2 oxygens are attached, so it is sulfonyl. And this is the structure of the pyrimidine. At the fourth position, the methyl is attached. So this is the structure of the pyrimidine. Here in the fifth position, a phenyl group is there. So to the phenyl in the second position, ethoxy group is attached. Here in the fifth position, the sulfonyl and this the piperazine structure. For this piperazine structure at the fourth position, methyl is attached. And here in the third position, one, two, three. Three carbon atoms are there. So it is propyl, and here in the first position the methyl group is attached. So here 5, 2, ethoxy, 5, 4, methyl, piperazine, 1YL, sulfonyl, this is the phenyl, 1 methyl, 3 propyl, pyrazole, pyrimidine, 7 ore. So this is the IUPAC and the structure. So it is a medication mainly used to treat erectile dysfunction and also the hypertension. So this drug is given by oral route and intravenous route of administration, and it is metabolized by cytochrome enzyme in the liver, and it is eliminated through the urine. Next, adverse drug reaction: headache, heat burn, loss of hearing and vision problem, nasal congestion, and photophobia means they cannot able to expose themselves to the sunlight, and low blood pressure, stroke, and heart attack. And uses: it is used in the treatment of the sexual erection, hypertension, and high altitude pulmonary edema, and these are the for this problems this drug we can able to use. So next drug is Tadalafil. So this is drug name is Tadalafil, and this is the structure, and this is the IUPAC name. If you see the IUPAC name 2, 1, 3 benzodiazole, 5YL, 6 methyl, 3, 6, 17 triaza tetracyclo heptadecatetrine, 4, 7 diol. I will repeat it again. 2, 1, 3 benzodiazole, 5YL, 6 methyl, 3, 6, 17 triaza tetracycloheptadecatetrine, 4, 7 diol. So here 1, 2, 3, 4. So 4 cycles are there. So it is tetracyclo. So for this tetracyclo, in the second position, benzodiazole is structure is present. So this is benzodiazole. For this benzodiazole, in first position and third position, 2 oxygens are there. So it is dioxole. So it is 1, 3 benzodiazole. This structure at the fifth position, it is attached to the 4 cyclic structure. So it is 5YL. Again in the sixth position, one of the methyl group is there. In third, sixth, and 17th position, 3 nitrogens are there. How many? 3. So it is triaza. So nitrogen is named as aza. So it is triaza. And in fourth position and the seventh position, 2 oxygens are there. So it is diol. So finally the structure is 2, 1, 3 benzodiazole, 5YL, 6 methyl, 3, 6, 17 triaza tetra 1, 2, 3, 4 tetracycloheptadecatetrine, 4, 7 diol. So this is the structure and IUPAC name. So this drug is mainly used in the treatment of the erectile dysfunction, hypertension. So it is given through the oral route of administration, and it is metabolized in the liver by cytochrome enzyme, and it is eliminated through the urine. So adverse drug reactions are headache, nausea, runny nose, cardiovascular disease means which is related to the heart, low pulmonary artery pressure, muscle pain, loss of hearing, back pain, vision problems. So these are the adverse drug reactions and uses. It is used in the treatment of the erectile dysfunction, hypertension, and benign prostate hypertrophy. So these are the uses. So these are the references books which has been followed for the erectile dysfunction. So these are the books. Thank you.